Well, hey, everybody. My name is Matt Vogl, and I'm the CEO and one of the founders of VXVY Mental Health. And I'll talk about our name in just a minute. But I want to thank everybody for joining us this morning. And this is the first of our regular education seminars that we're doing for members of VXVY. And I'll talk about our membership in a little bit. But we're going to do these kinds of educational seminars pretty regularly. And we just thought that for the first one, it made sense to just talk about VXVY and talk about our organization, what we do, and most importantly, why we're doing it. And that's really the key part of the story. And I'll spend a lot of time today talking about the why. But it's really great to have you all here. I have to address it. I was on a conference call this morning, and somebody asked me, they said, do you have glasses that match all of your shirts? And I said, I do, but I only own one shirt. So that's what you're seeing today. Because we only have a half an hour and I always pack about, an hour's worth of material into 30 minutes, it means two things. One is that I talk really fast. So if you miss anything, you can certainly reach out and ask us or ask me to need to make sure the slide's not advancing for whatever reason. There we go. You can always email if there's something that wasn't clear. We're going to not have question and answers today, just in the interest of time. And also because apparently at least one of my brothers registered for this talk today, and I don't trust him in a Q&A session. So we're just going to cut that off. If you have questions, please email us and we'll get right back to you. So I want to start and just address the elephant in the room, which is what's the deal with our weird name, VXVY, no vowels? Well, it actually comes from aviation, and I have some nephews who are pilots, and they influence the decision on our name. VX and VY are the calculations that pilots use to estimate the best speed and angle for a plane to take off and avoid obstacles and quickly get to altitude. And we think it's a really great metaphor for the work that we're doing with the digital mental health industry. And our goal is to help that industry realize its full potential. So as I mentioned, it's really important to start at the, square one, and let's talk about why VXVY exists. And there's a major problem, and I don't have to tell anybody that our system of care and mental health is pretty broken, but it's important to think about why it's broken. So we know that, 1 in 5 Americans has a mental health condition. These conditions like depression and anxiety, bipolar, are very, very prevalent. But the alarming statistic is that about 80% of those people either get no care at all or they get inadequate care. And that's a huge problem. And so to understand that, we need to drill down and really try to understand the nuances of why our system is such a mess. And I think that there's 3 key reasons. The first one is simple supply and demand. We've seen the demand for care increase steadily over recent years. Part of that is because we've done a better job with stigma, so people feel more comfortable talking about mental health and their struggles with it, and they feel more comfortable going and trying to access care so that they can get better. But at the same time, the supply of providers is shrinking. So for over a decade, every year, the mental health workforce in the United States has been getting smaller because people are retiring, and the number of people going into the field is less than the number of people leaving the field on an annual basis. So you can see that that's a huge problem. And when you have this imbalance in supply and demand like we have in mental health, it really has a couple of pretty bad impacts. One is that it leads to greatly increased wait times for care. It's not uncommon. I used to manage an outpatient practice at the University of Colorado, and it was pretty common for us to see our wait list balloon to 4 and even 5 months long, especially, in sometimes even longer if you were looking for specialty care like geriatric care or care for adolescents. And, wait times in mental health, it's not just a matter of convenience. It's, the lives are at stake. I keep a photograph taped to my desk, and I have had this photograph taped there for about the last 10 years or so. It was given to me by a mom of a girl who in Douglas County, Colorado, who took her life while she was on a wait list to get care for her depression, and she just couldn't wait as long. So when we talk about wait lists in mental health, it's important to know that we're talking about lives, and that lives are at stake when we have these long wait lists. The other problem is that when you have a long wait list, or when you have this imbalance in supply and demand, it creates an incentive for providers to no longer take insurance, because they know that their practices are full, they have wait lists, and so they're always going to be able to get patients into their system. So why bother taking insurance and going through all the hassle and the administrative obstacles and hurdles that they have to go through to take insurance, oftentimes for less money? So they can just become a cash only provider, have fewer hassles, and make more money. But for most people who rely on commercial insurance to access their health care and their mental health care, that creates an even bigger access problem, because not only is it hard to find somewhere that has an appointment that can get you in, but it's a lot harder to find a place that will be able to get you in to use your insurance. And so as a result, care becomes very expensive, and many people simply can't afford it. And that's why when we said at the beginning that many people get inadequate care, very often people have to leave their treatment early because they just can't afford to continue. The other two areas that I think are really important to focus on are mental health has lagged behind most of the rest of medicine in embracing prevention. If you think about, cardiac care and, groups like the American Heart Association that have poured millions and millions of dollars in aggressive campaigns teaching people how to prevent heart attacks, how to prevent heart disease, all the lifestyle things that we can do around exercise and diet and the things to keep us healthy. But we really haven't done a good job of that in the United States and even worldwide in embracing prevention. So what happens, and the reason that that's important, is that people just wait until they're sick, and then they need to scramble to get care in a system that is already overwhelmed and have these long wait lists. So it means that we're putting more people in that line. If we can have effective prevention and doing things, to help the people who are already doing well stay well, we can't prevent all mental illness, but there's some, depression and some anxiety that we can prevent, and that will put fewer people in the queue and shorten those wait lists if we do more in the prevention space. The other area is that mental health care is the most inefficient discipline in all of medicine. If you think about primary care, you might see your primary care doc for 15 minutes, maybe 2-3 times a year, and that's it. In mental health, you might be going to see your provider, seeing your psychiatrist, your psychologist for an hour twice a month, sometimes even more for a year or 2 years. And so when you have each individual provider and you look at what a primary care doc would get you in terms of capacity in your clinic compared to a psychiatrist, if you had both of those at the same salary that you hired into a practice, a primary care doc is going to get you several thousand new patients of capacity just with one provider, because they're only seeing people a handful of times and for a shorter amount of time. With a psychiatrist, you might be having people that are, coming in, as I mentioned, for hours. That psychiatrist at the same salary might only get you about 300 new patients. So the take-home message here is that we really can't clinic our way out of this problem that we have. But there's a solution. And the solution, we think, is digital mental health. It's certainly not going to solve all of the problems, but if we have well-developed, well-thought-out, and well-researched digital mental health products, we think that we can solve a lot of the problems. So when we talk about digital mental health, we're talking about things like software, websites, devices like virtual reality, telehealth, which, during the pandemic, of course, exploded. And I think everybody on this call has, had a telehealth visit. Apps, there's over 20,000 mental health apps in the app stores in Google and Apple. Devices and wearables like watches and the smart rings. And so, when we talk about virtual mental health, Alexa, some of the, the home speakers and things, all of those fall under the category of, or the heading of digital mental health. And if it's done right, it can help across that whole spectrum. It's not just improving the way that we treat disease, but it can improve the training of mental health providers and make that training more efficient and effective. It helps people in the prevention space, like I was talking about. It can improve our ability to diagnose conditions more quickly. One of the challenges for conditions like bipolar is that there's not, a blood test or a simple screen for that. It involves an interview and talking about family history. And so the time to get from when a patient comes in to get to an accurate diagnosis can sometimes be weeks or even months. If we can shorten that, we can increase capacity. And then recovery. So the people who have gotten better, let's keep them better so they don't have to go back into the system. And Digital mental health, this is not a complete list, but, we can address all kinds of conditions. Mental health diagnoses like, depression, sleep disorders, anxiety, ADHD, but also some of the other things like addiction, pain management, and then, of course, the ultimate bad outcome that we want to be able to avoid, which is suicide. And if we do all of this, and if we get digital mental health right, then we can come up with care that is more engaging, that people are more likely to stick with, that's more affordable, because we can build these things and scale them and make the cost of care less than just going to a psychiatrist for 2 years. We can make it more accessible so that people can get care right away and at least start the process without having to wait for 5 months. The care can be more coordinated. Apps can help providers talk with one another so that your psychologist, your primary care doc, and your psychiatrist all are involved in your care and they're hearing the same things. And we can, in the process, make that care more efficient, shorten those wait times, and ultimately we can also, make the care more effective. But there's another problem. It's not that simple. The digital mental health industry needs a lot of assistance. And this is really why VXVY is here. So I want to spend a few minutes on this slide. There's a number of problems in the digital mental health and the tech industry right now. The first one is that products tend to get overhyped. Anybody who's seen one of Apple's big, unveiling conferences that they do, where they say, you have to get the new iPhone, and all of a sudden people are camping out over line just because of the new, whatever chip is in the phone. The Segway scooter, before it was unveiled, they were telling people that it was going to change the way that cities were designed and that it would revolutionize transportation. And so, the tech industry can't always be trusted because of the way that they hype their products, which leads to the second point, which is consumer confusion. So people like you and me, when there's 10,000, 20,000 apps to choose from in the mental health space, how do you know what's good or bad? And there's not a lot of tools out there. So we rely on things, like how many stars, is the rating have, or if you look at all of the advertising for these apps, they always talk about the number of downloads. Calm, for example, always boasts that they've had 120 million downloads. They're one of the most popular mental health apps that's out there. But beyond those statistics, there's some interesting things that we need to be aware of. Of the people, the 120 million that have downloaded Calm, only about 3% go on to buy a subscription to that. There's about 5 million apps total across the different app stores. About 350,000 of those are health apps, and about 20,000 are mental health apps, as I've mentioned. About a quarter of those apps only get opened once. And after just 30 days, only about 3.2% is the estimate of those apps are used after 30 days. So when you talk about the number of downloads, it's really not telling you the quality of an app. And I'm not making a judgment against Calm or any of these others, but you have to look deeper, and there's just not a lot of resources out there for consumers to sort through things. The lack of evidence for apps and devices and virtual reality is a huge problem. Lots of companies claim that their apps are backed by science. There's one that I won't go into too much detail, but there's one that I love to pick on. That this was an app, or a device rather, that was on Shark Tank a number of years ago, and on their website you went to it and they boasted that this is backed by decades of science, and they referenced there were 22 scientific studies supporting its effectiveness. Well, when you looked at those 22 studies, only 19 of them, or 19 of them were done before the technology even existed. They were published before 1977. And the remaining 2, only one of them was actually done on the product itself, and that was done by a grad student who had a connection to the company. There were only 5 participants in the study. It was unpublished and not peer reviewed. So, hardly the claim that it was backed by decades of science, and we see that all the time. And for a variety of reasons, the developers oftentimes bypass doing rigorous studies of the effectiveness of their products. Some of this relates to the lack of expertise that's brought in on the design process. And when I talk about the lack of expertise, there's really 2 areas. One is subject matter experts, like are they bringing in psychologists and psychiatrists who really understand mental health treatment, and the nuances of mental health care, but also the end users. They're not talking to patients during the design process. They're not talking to the providers who will be prescribing these apps or recommending them to their patients. And that's something that really needs to change, is to get those experts involved in the design process much earlier. Another area is privacy and security. I don't know a lot of people that trust, people like, Mark Zuckerberg and Elon Musk with their personal health data. And so that's a huge concern when we talk about these apps and the way that they're transmitting data from providers. But, if you look at the terms of service, those things that nobody ever reads, we just scroll to the bottom and check so that we can get right into the fun stuff. Oftentimes there's some pretty concerning things that, that we unwittingly enable them to do to use our personal data. All kinds of regulatory problems. The FDA, waited too long to get into the business of how are they going to regulate these apps and ensure quality. So now they have a process to evaluate digital therapeutics, but it really only applies to a very small percentage of the apps and devices that are out there. And I think most people, if you talk to people in the industry, most of us agree that the FDA is really evaluating these things in the wrong way, because they're focusing on doing clinical trials in the same way that we do for drugs and devices. But it's very, very different with digital therapeutics, because if you have a study that you're doing on an app, for example, and in a clinical trial, you're incentivizing the participants and saying, okay, we'll give you a gift card if you're using this every day and logging on. And they're not really showing you how these products function in the real world, where they need to be much more engaging. Otherwise, people won't come back to them. Going back to the statistics I referenced earlier on the tiny percentage of people that actually use these apps and products after they've been downloaded. So we need to improve the way that we regulate them and evaluate them. Reimbursement is a huge problem. A lot of people spend millions of dollars on developing a product only to find out that either consumers can't afford it or insurance and Medicare and Medicaid won't reimburse for it. And they find that out too late in the process. And then, you have very good products that could otherwise help people, but the companies end up failing because they can't generate revenue. And then the last area where we need a lot of assistance is in the area of decision support. And this applies to people like investors and helping them be able to choose products that are right for them and right for their workforce. Oftentimes they're just going on advertising, just like the rest of us. But there's a real science to what they need to do to be able to make the right decisions. And so there's a solution to that problem. That's VXVY. We're a brand new organization, but we've been around for about 7 years. Our organization started 7 years ago at the University of Colorado, and it was a center that I helped found, and we raised about $10 million in philanthropic support for it. And we, trying to identify where could we make an impact in improving the quality of mental health in the United States and eventually globally. So we started this center. It was really the first of its kind, where we tried to develop effective models to improve and streamline mental health technology adoption, how to make these products more science-based, how to make them more engaging, and how to make them more widely used. And to do that, we created something called the Tech Innovation Network. And the Tech Innovation Network is a collection of organizations ranging from medical settings, mental health settings, but also police and fire departments, schools, employers, prisons, really you name it, any organization that struggled with the mental health needs of either their customers and or their employees that might benefit from digital mental health solutions. So we got those groups together so that they could help inform the design process, as I was mentioning earlier, so that we brought the end users into the process much earlier. And it also gave us an environment where we could do studies and test the efficacy of these products and look at things like engagement, how do you implement them, because we know that there's a lot of products that are really great, but they get implemented the wrong way. And all of a sudden in organization, an employer or a health plan, they just don't get used anymore, even though they're great, because people didn't think through some of the obstacles to having them work really efficiently and effectively in their organization. We decided this last year to leave the University of Colorado, and we did that for a number of reasons, but the primary one is that universities are slow moving and we wanted to be able to be more nimble. And then, there's other issues, like universities are much more focused on, conducting clinical trials, and we wanted to be able to work with industry very closely and solve these problems in real time. So we're now an independent organization. We launched VXVY back in October. And we have an affiliation now with Tulane University. So we're not under Tulane, but we're able to access Tulane's research infrastructure so that when we want to do research trials and things like that, our staff have faculty appointments there so that they can continue to do that work. Well, we really think that when we talk about the VXVY solution and our approach, there's really three main areas that we focus on. The first one is promoting effective investment. If investors, the venture capitalists and other investors are not investing in the right things, then that means more junk coming to market. Going back to the 20,000 apps, there's some great stuff in there, but there's an awful lot of junk because people have invested in the wrong things. So we want to help those investors understand some of the best things, help them de-risk their portfolios so that they're putting money into companies that are more likely to build effective products and more likely to survive long term. The second is to build a network. I mentioned the Tech Innovation Network, and we've reconstructed that under VXVY, and it's a collection of tech companies, health systems, the end users, investors. So it's really the same thing that we had with the TIN, but greatly expanded so that everybody, every kind of organization that's in any way touched by mental health and mental illness can be part of the process of helping to bring great digital mental health to the marketplace. And then the last area is that we want to make sure that the stuff that does make it to market is really high quality, that it's safe, that it's effective, that it's been thoroughly researched, and that it's widely used. These products aren't going to be able to help us address the big, larger systems issues that I was mentioning earlier unless they're really great products and unless lots of people are using them. Just having a handful of users isn't going to make a dent in the problems that we have. So I talked about the network, and this is just a diagram of it. We think there's kind of four big buckets for our network. Investors, who are again driving everything because they're the source of funding to develop these products and help them get out into the marketplace. Healthcare systems, they serve lots of people, and so it's a great place to make a huge impact. The same thing with employers. If we can, get a company like Coca-Cola to have a big rollout of tech solutions, for their workforce, then we can have a massive impact by just working with one individual company. The community partners, then that's, again, everything from schools, clinical providers, both individual or group practices, hospitals, emergency responders, every kind of organization that you can think of. And then the tech innovators, which are the people who are designing the digital therapeutics, whether it's a large tech company or some of the smaller startups that we work with. So we have a membership model, and that's the network I was talking about. And we're happy to announce today for the first time that we've made the decision to now make membership free because we realized that cost was sometimes an obstacle for people to be able to join our network and participate. And we're only going to have the kind of industry-wide impact that we want to have if we can bring lots of people into it. So for free, any organization can join us, and they can, you see this list. I won't read down all the bullet points, but they can, we help facilitate connections with other network members so they can learn from one another. We help them with their business and some of the, the business development things, help them get exposure and promotion for their company and for their products to be able to sell more and get more things into the hands of users. And then educational opportunities. So things like this seminar that we're going to do on an ongoing basis. And then in addition to that, we have a number of services, and this is really our bread and butter, that we offer in addition for additional fees to organizations where we can help them de-risk their technology, help improve employment, help investors and employers be able to look at different products and figure out what's the best one to go with. As I mentioned, helping people implement and design the implementation process, looking at the market for various products and helping people understand where their product might fit. There's organizations that we worked with that said, oh, we want to have this product that's designed for use in mental health treatment, and we said, well, actually that might have application in addictions or in schools. Let's try it out in those environments and see how it works. Oftentimes, this goes back to helping people make the diligence and investment support. But oftentimes, there's not just one solution for an organization. A lot of companies might say, "Oh, we're going to give all of our employees access to Headspace and then call it a day and say that we checked the mental health box." But it's not so simple. There's not one size fits all with these products, and so oftentimes it's having several things bundled together to be able to get the outcomes that you want. conducting clinical trials, working on some of the things I mentioned earlier, like reimbursement and regulatory, and then helping them develop content for their products and make overall improvements. So we have, been working at this for 7 years. This is just a few of our partners that we were really excited to have them, give us great feedback. We think that we've had a lot of successes with companies, like Trip, Limbix Health. Limbix is a company that has an app that facilitates doing cognitive behavioral therapy for adolescents. And Tom Insel, who used to direct the National Institutes of Mental Health, and he's now a tech entrepreneur. He was the mental health czar for California, and we've worked with Tom on several different projects, and he's a big fan of the organization. So we really feel that this approach is validated that for what we're trying to do with VXVY. I probably should have put this slide up front because these are the people that really make it all happen. And there's two of our folks that are not on here, Zach and Rocky. If you're on here, apologies that I don't have your pictures yet. They're helping us with tech vetting. What our staff is small but mighty. And so, with this group of people, we have experts in psychology, psychiatry, project management, public health, business development, and even things, if you need a juggler or a volleyball player or a rugby player, we have all of that with this really amazing staff that we have. And, together collectively, this whole group came, together from the university. All of us left and all of us stayed with VXVY. And we've been at this work both together and then independently before that for decades. And so we really have a lot of expertise in the mental health space, and we were the first organization of our kind when we started at CU. So together, we really think that we can do this. Our goal is not just to help individual organizations or companies. That's our strategy. But our ultimate goal is that we want to change an entire industry. We want to influence the digital mental health industry and elevate the quality of the products, get them in the hands of the people that need them most, make sure that people who are underserved have access to all of these products. And we can, in the process, we can transform millions and millions of lives. And at the end of the day, we are and always will be a mission-driven organization, and we're here because we want to help people, and we think that this is the best approach that we can take to do that. So we want people to join us. If you're an organization watching today that's not a member, please join us. Go to our website, VXVYmentalhealth.com, and you can find more information about our memberships and apply and become one. And like I said, if you have any questions about the talk today or things that came up that you just didn't understand because I was talking too fast, please email us at info@VXVYmentalhealth.com. So with that, I'll thank you for joining the webinar today. And when you become a member, you'll get notices about our future educational seminars and series. And we have some really, really great stuff that's already lined up for that. So hope people join us. And thanks again for your time today.